And we have Dr. MOHAMMED AGHA with us. He is a senior specialist gynecologist at Fakeeh University Hospital here in Dubai, Silicon Oasis. And he was courteous enough to join me today to answer a few questions. A lot of you all have been asking me in terms of your health, specifically all my friends who are like me in between their 30s and 40s. So, Dr. Agha, if you'd like to say something about yourself, something to add, and then I can throw in my questions.
All right, good afternoon. I don't know if you're all here in Dubai or around the world, so good morning, good afternoon, good evening, wherever you are. I hope you're all enjoying a good day. So I'm Dr. MOHAMMED ABDULLAH AGHA, or Consultant Obstetrician and Gynecologist, currently working in Fakeeh University Hospital in Dubai. So I've been in this specialty for more than 22 years old, 22 years now. I started in Iraq, then went to UK, and then back to United Emirates. I'm currently the chairperson of the Women's Health Department in Fakeeh University Hospital, and we are trying to help women at all aspects of their reproductive health, pregnancy, maternity, and gynecology. So today I hope I will be quite helpful for you to answer any questions or to debust any myths or to clear any queries in your minds about anything that you like to ask about. And thank you so much for giving me this opportunity.
Thank you, Dr. coming in. So 30s and 40s are like a 10 years different range, and we keep talking about from the teenage itself about our hormonal health. So one of the questions that I get is that I hear is like the women in their which are reaching their 30s, they're like, oh, I'm going towards my 30s, and I have not planned a kid yet, and it would be too late. And we are often told like you're doing it too late, and it's not the right time to have a child. So women who are in their early 30s and who are yet to conceive or considering a late marriage and late pregnancy, what would you say are the myths that are being told, and what really happens to the hormonal health when it comes to age and fertility?
Right, so yes, as you said, now if we talk about possibly without stereotyping a typical modern woman in her 30s or 40s, we can see a professional woman in the middle of her profession or getting up in this ladder of professional career and still trying to achieve her goals. And because of that, she's quite busy in this aspect of her life. She postponed her marriage, or she got married, but she's postponing her childbearing thing. So that's a modern thing that's happening nowadays. With it, there are possibly other aspects we may talk later about, is that being in the middle of that stress of her job or career, possibly adding other lifestyle issues like not exercising, the eating, the smoking, and other aspects. So if we talk about this woman who has gone through the 30s and not having a child yet, yes, we know that one fact is that a woman is born with a limited number of eggs, and these eggs will be used during her reproductive life until they are exhausted when she reaches the menopause age. And also with time, the quality of these eggs may get reduced. And when we talk about quality means there will be higher chance of either pregnancy losses like miscarriages or chromosomal anomalies, like the common things we talk about, Down syndrome, for example, and there are many others. So the later the pregnancy gets a child or pregnancy, these risks will increase. Now, if we talk from the beginning about fertility potential, yes, unfortunately, it will get reduced more likely after 35 years old. There will be a decline in what we call the ovarian reserve. That's the number of follicles or the potential of the ovary to achieve pregnancy. And we'll see a gradual decline in that. That doesn't mean she will wake up in one morning and there is no chance of getting pregnant. It's not like that, but it's a gradual process. It will start declining until reaching 40s and then above 40s. Still, in theory, any woman menstruating or releasing eggs, she has the potential to get pregnant. But we are talking about the likelihood of achieving that. So the older she gets, the less likelihood of achieving pregnancy. Therefore, we advise the woman, if she can get pregnant or uh, complete her family the earlier possible in her life. If not, and she feels still it's not the time for her to get pregnant, now there is an option of egg freezing that she can go for. Many women, they say, okay, I'm not ready now for this, or I'm in the middle of my career, or I'm not finding Mr. Right to have a family with. So they can go have their eggs first stimulated and then collected, get frozen, and kept for her whenever she feels she's ready for that step. If she doesn't do that, if she gets married, let's say around middle of 30s, more than 30s, we don't advise her to wait for a long time, especially if there is any other issues she may have with her menstruation or her medical background or with her partner or anything else. So we advise them not to wait more than 6 months. If they don't achieve a pregnancy after regular intercourse or sexual relationship with her partner, then she needs to go and check with the gynecologist to check about her fertility potential and if there is any issue, and she starts investigations, and then we'll see how we can help with. So the earlier she does that, the better. So that's one aspect. The other aspect is getting pregnant. So if she manages to get pregnant, yes, the risks of pregnancy will be higher. And again, we're talking about the chromosomal anomalies we talked about. And for that, we have a special test to screen the pregnancy. The other things that we know, certain medical conditions may increase with pregnancy if the woman gets older, like diabetes, high blood pressure, or other medical problems that may increase with age. So the woman needs to be checked early once she gets pregnant. She may need even a preconception counseling visit to address all her health issues before getting pregnant, and she gets advice about that. And whenever she feels she's pregnant, she needs to check with her obstetrician to set a plan for her antenatal care and to set a plan for her delivery. So all these things are important for her because the risk of pregnancy might get increased with age. I think for now that answers the questions. Yes.
Yes, definitely. That does, doctor. And that brings me to my second question, where you talked about screenings and the status of their health. So, what would be the frequency that women should go for a women's health checkup? Because often, until unless it's something that is on top priority, specifically when considering working women or women at women working from home or women at home. Usually we tend to ignore our health and then would take care of everybody in the family. So what would be the frequency that you'd suggest, and that a woman should be undergoing those, well women checks that are available usually?
So we would advise women, in case she doesn't complain of anything or doesn't feel there's anything wrong with them, we would advise them to see a gynecologist at least once a year, so that they still talk about the frequency, duration, amount of of her periods, and if her periods are becoming more painful, if they are regular, if there is any bleeding in between the periods, if she's complaining of pain unrelated to the periods, or it happens at certain times of the month, if there's any issues with the intercourse or sexual relationship, like having pain or bleeding, or if there is any other things she likes to address, like contraception or fertility, or having, for example, a new relationship, or she should do for that or whatever. So these regular visits once a year, these are important. Now, and during these visits, in addition to have this talk, she will need a simple pelvic examination. We may do a simple or quick ultrasound scan to make sure the ovaries are okay, the uterus and other organs are fine. If there is any other symptoms or signs, we may address them. Like, for example, if we feel there is infection, we take a swab. If we feel there is a cyst or anything on the ovaries, we may order more imaging tests like MRI or anything else. And then we have the one of the important screening tests we do is the cervical cancer screening. That's the pap smear. Now, the pap smear, and we know that in different parts of the world, they may do it every 3 years, or other parts they may do it every 5 years. Here in UAE, because we don't have a kind of robust screening program, we would do opportunistic kind of smears whenever we see the woman, but we advise them to do it once a year, just to guarantee that the woman will remember to come back to us. But if we go like a routine thing, at least it needs to be done once every 3 years until the age of 50. Right, and that's in case there is no other symptoms. But if the woman is feeling she's having a problem or a symptom, then definitely she needs to come earlier than that. We will come to education at some point of time of the talk later. The women need to be well educated and aware of what is normal and what is abnormal, and they because they may live with something which is abnormal, but they're not aware of it. And they feel, all right, my mom had this before, or my sisters had this before, and that should be something normal. I don't need to go and check, and I don't need to ask about it. No, that's not the case. You need to report or to mention whatever you are having in your sexual or reproductive life, and then see if this is really a normal thing, or no, this is something we need to test or check about or talk about or do anything else for it.
Okay. That's a good information, doctor. I think I'm due my health checks as well.
Yeah.
I wanted to one last question, I would say, but it's like, you did speak about obesity, you did speak about being inactive, physically inactive. So I would say fitness and sugar and wine and smoking. Which of these would you say are women's best friends or foes? The friends and the foes.
Well, if there are these things helping you to manage stress for some bit and make you feel better, that's fine. They are friends, but just very momentarily. But then they will be your worst enemies. So yes, if you just dedicate your whole podcast or whatever the live broadcast and you just repeat 2 words, obesity, stress all the time, it's still not enough to address this issue. I think these are the most serious killers for all people generally, and women specifically. And unfortunately, these are rising issues. So even smoking, yes, smoking is dangerous and risky, but we know that possibly over the world, the number of smokers are reducing because of all these campaigns and knowledge and education about smoking and its effects. So it's getting less. But the obesity and stress, these are kind of hidden, still not very well addressed. The obesity is fine, but the stress, I think, still needs to be addressed more seriously. Because if we talk about women, they can affect the reproductive health and fertility. They can change the pattern of menstruation. They can lead to other problems if they are not managed. And because of stress, we will see kind of unhealthy lifestyle things like bad eating habits, like junk foods, the fast food, avoiding the healthy food. Stress comes, for example, with long working hours and working in shifts. So one sector that's classically affected by that is the staff working in healthcare system, ironically speaking, because they work. So, for example, the nurses or doctors, they work long shifts overnight. They will only see in front of their eyes the chips or snacks or whatever, and because of the stress, this gives them some quick pleasure or help to manage their stress. But then gradually they will see they'll have weight issues and health related issues. So these are very important. Smoking, again, we said, it's already known to be risky for women. It can reduce the fertility potential and the ovarian reserve. And definitely it's risky in pregnancy. And we advise women to stop smoking if they get pregnant. Alcohol, in general, the woman can have alcohol, but for a limit. And that's about 1 to 2 units per day. and not to what they call binge drinking. That's drinking too much or too many units in one session, or get intoxicated. They need to have these drinking episodes kind of separated over a few days rather than on one day. And again, if they get pregnant, they need to stop it. Even if the studies show that possibly small amounts of drinking alcohol may not be effective, but there's no guarantee for that. So that's why the advice in pregnancy to stop smoking, to stop alcohol drinking, because they can affect the pregnancy and baby very badly. And there are many short-term and long-term consequences for that on the baby. So these are important things. Obesity, as we mentioned, it's becoming more publicly addressed around the world. It affects all the organs, all the systems, different aspects of health and well-being for people. For the woman, it can cause changes in their menstruation. So things like polycystic ovaries. And because of that, there will be increased thickness of the lining of the womb, that's the endometrium, and that will end up later with the cancer of the lining of the womb, the cancer of endometrium. And we have seen that, we are seeing that because the classical age of this cancer usually is more than 45 or 50, but now this is becoming younger or coming to less than 40s because of obesity and because of polycystic ovaries, unfortunately. And we are starting to see, there are not a lot, but we are starting to see that shift in demography. Women in their 30s still not achieve their family goals or having enough number of children, and they develop the cancer. And then we get into that big question, what should we do? That's why there is a new topic now in gynecology oncology, that's fertility preserving surgeries or therapies for cancer, because we are seeing more women, they are younger, they are still fertile, still trying to achieve their fertility or complete their family, but they get the cancer. So we need to find the right option for them to treat them from these diseases and to make them achieve their potentials or goals.
Great. So, Doc, I think the only friend left is like fitness, and that would be like physical and mental fitness. What would you recommend ideally to all the women who come to you, to achieve their accurate or adequate level of fitness that, that helps them avoid the stress, the obesity, and the relevant factors that could take the health down?
Yes, so as you said, so fitness, healthy lifestyle, exercising, in addition to healthy food and intake, these are the best weapons for women to fight all the things that I just mentioned earlier. So for the exercises, we have two things. So weight-bearing aerobic exercises like swimming, walking, jogging, cycling. These things the women are advised to do, let's say around 30 to 60 minutes per day for most of the days of the week, like 5 days a week. They can do that. Why is that in this age group specifically? Because we know after 30s, the metabolism starts slowing down. And if we combine this with the bad eating habits and stress and less activity, then we will see increasing number of obese women or increasing obesity. So the exercising will try to reduce that and will burn the calories. Women also need to do the strength exercise like weight bearing and other things, but they need to do it less frequently, 2 or 3 times per week, because we know the muscle will be starting to be wasted after 30s and more commonly after the menopause. The same for bone density, and the incidence or the number of osteoporosis will increase. Though these kind of exercises will prevent these things from happening and will keep the muscle bulk, and they will keep the well-being of the woman for longer time. Stress, as you mentioned, the best ways to do that is either by relaxation exercises, yoga, having good habits, having good friends to spend time with, gardening, reading, anything that a woman can feel better with, because stress can be a serious issue as well. So yes, so these are important things, and add to it is the good eating habits. So having intake full of vegetables, fruits, especially the dark colored fruits, which are rich in antioxidants. These are very helpful for the ovaries. Reducing the fat, the saturated oil, the junk food, the sugary diets, the fizzy drinks, the sweets, all these needs to be reduced. You can have protein in the form of meat, but better to be lean meat rather than the fat with it. The omega containing food like the seafood or fish, these are important, and chicken, all these things are important for the woman.
I think that covers all of it, Doctor. Thank you so much for your time and the valuable information. I think most of the myths and the questions are answered, and I would get back to you when I have more questions.
Yes.
Thank you so much again for your time today,
Thank you so much.
and
Thank you. It's my
look
pleasure.
forward to more of these. Thank you.
Thank you so much. I hope everybody got the benefit of that talk.
Yes, definitely. Thank you,
Okay,
Doctor.
thank you so much. Take care.